Many things contribute to the possibility of having diastasis recti during pregnancy. Nutrition plays a very large role in the health of the connective tissue and the fascia. Our lifestyle, the amount of stress that we experience, will also play a big role. Our exercise choices, whether we're having multiples or if it's our second or third baby. But the main issue that I see in causing diastasis recti is intra-abdominal pressure. So intra-abdominal pressure is the pressure inside of the abdominal cavity. And during pregnancy, because of the weight of the baby, the pregnant woman experiences even more pressure. So the pressure is going to kind of push down on the pelvic floor and out on the abdominal wall. Now, in a properly functioning core, the inner core unit will lift and kind of hug in against added pressure under load. But most women do not have a properly functioning core. So instead, that pressure is going to push down on the pelvic floor and out on the front of the belly. And that's why you might experience leaking when you cough, jump, or sneeze, or some tension or pulling down the front of the abdominals when you bend forward or pick up something heavy. So that's kind of that pressure being mismanaged. It's not being managed in a way that's controlled, it's being mismanaged in a way that it's kind of losing the control. So it's pushing down on those muscles over and over and over again through our activities of daily life. Now, why don't most women have a properly functioning inner core unit? Because we like to hold our belly in nice and tight, right? So we have everything sucked in. Whenever we suck in everything, we're no longer breathing with our diaphragm and our belly, we're only breathing with our chest. So the diaphragm muscle becomes weak and inhibited, and then we lose the awareness of the pelvic floor. So it's really hard to kind of hold that pelvic floor up and in, but also we can't figure out how to let it relax either. So holding the belly in nice and tight is going to decrease our ability to really breathe properly. And if we can't breathe diaphragmatically, then we're not using the inner core unit the way that it's made to be used, which is a relaxation on the inhale and then the gentle recoil on the exhale. So if the relaxation on the inhale is going to let the diaphragm come down and the pelvic floor relax, the recoil is going to lift the pelvic floor up and bring the abdominals in. And that's that pressure control system. So for the most part, intra-abdominal pressure is going to be the main cause for diastasis recti. And then from there, if we learn how to breathe properly and we learn how to manage that pressure, we can give us even more support by making sure we have adequate protein and that our stress is managed in a healthy way.